Madam, let us check your assessment report. On the left, it is the image that the device simulates based on your current physical condition. Intuitively, different colors indicate that the organs are in different functional states. The best color hue is pale and transparent, indicating that the organs are in balance. These areas with color change all indicate that the organ function has been abnormal, which needs your attention and improvement. If you do not pay attention, the consequences must be the occurrence of disease. On the right, we use a histogram to show the degree of current variation of each body system. The higher the column, the greater the risk of the corresponding region. The absence of a column indicates that the risk is currently negligible. In terms of the overall results, what you should pay most attention to is the digestive system. Let's start with the hepatobiliary region. From the figure, it is clear that the region appears blue and the image is flashing. Flash is the highlight in our system, which means that your hepatobiliary region is clearly in a declining condition. And in combination with the indicator, your transaminases and alkaline phosphatase are both in an abnormal upward trend. Liver is the most important organ for our body to metabolize fat, and its continued weakening will inevitably lead to the imbalance of lipolysis. In terms of the result, your lipolysis is obviously on a downward trend. And we can see the lipolysis is obviously on a downward trend, resulting in a large amount of lipid accumulation in the body, which can't be metabolized. That is, you currently have metabolic disorders. Given these circumstances, it is significant that you now have fatty liver and lipid accumulation. This phenomena inevitably lead to the abnormal increase in blood lipid. That is to say, there are also risks in blood lipids. On the index, your LDL, that is cholesterol, it is also abnormally elevated. So I suggest you to do a detailed examination on liver and gastro and gallbladder. Especially on the biochemical aspects of blood lipid. In addition to the liver, currently the pancreas region is also clearly showing a trend of declining. As you can see from the picture, the pancreas region is also dark blue and flashing. It indicates the decline of pancreatic function, which will inevitably lead to abnormal secretion of pancreas and affect the metabolic of sugar. Insulin is also significantly above a normal range in terms of hormone levels. So taken together, there are disorders in your sugar metabolism. I suggest you monitor the blood sugar situation. Might as well to go to the hospital and do a detailed screening for sugar tolerance. Your digestive system, the stomach, and the intestine also appears to be on a downward trend, with different degree of blue visible from the chart. The continuous functional weakening is bound to the occurrence of gastrointestinal disease. Some reactions will occur, such as bloating, stomach pain, and diarrhea. In view of such results, it is also suggested that you should adjust the diet, avoid the cold and spicy food, and take light and digestible diet. Meanwhile, the degeneration of cells in our device remains you to focus on the liver and the gastrointestinal tract. Since there is a tendency of pathological development, I suggest you take a detailed examination of liver and the gastrointestinal tract to the hospital. You could take a gastroscope to see if there were lesions. It is better to find the disease early and treat them early. In addition to the digestive system, there are other things you should be aware of. Let's look at the skeleton system. As far as bones are concerned, there are different degrees blue from the cervical vertebra to the entire sacral tail. It indicating that your osteoarticular vitality decrease and you are prone to stiff pain. At the same time, the system reminds you that your bone density has been reduced, and the decrease of bone mass will also increase your risk of osteoporosis. Therefore, it is recommended that you take proper calcium supplements and do more exercise to improve deposition and strengthen bone function. Now come to your cardiovascular system. Most of the myocardial function is fine, pale and transparent. However, in the superior and the inferior vena cava and the right ventricle region, dark blue appears clearly, indicating the lack of blood reflux, which obviously lead to lower limb circulation problems. So you will obviously have lower limb pain and stiffness. It is recommended that you soak your feet yearly, raise your right leg during rest, and increase the amount of cardiopulmonary resuscitation. Clinically, cardiovascular is inseparable from the cerebrovascular system. The insufficient circulation of the heart will also affect the blood supply of our brain. Our system specially reminds you that there is a circulation disorder in intracranial vessels. So let's look at your brain. From the whole picture, it is clear that the temporal lobe is blue and the frontal lobe is yellow. And this is an indication that there is some deficit in intracranial blood supply. Combined with your cholesterol situation, the risk of blood clots is very high. You should pay attention to the prevention of blood clots. In addition to that, I'd like to remind you to pay more attention to your respiratory system. In addition to that, I'd like to remind you to pay most attention to the respiratory system. As you can see, the entire respiratory system, including the trachea and the bronchi, and most of the lobes of the lung are also showing a tendency of decrease. At the same time, the cellular functional degeneration of our system also highlights the tendency of pulmonary function change. So I suggest you undertake detailed examination to the lung, respiratory tract, might as well do a chest piece to examine whether a respiratory tract has pathological change. Discover early and treat early, avoid illness aggravation. So that's the whole situation. And overall, what you need to pay attention or focus on. First, a detailed examination of the liver, gallbladder, gastrointestinal tract, and lung. Excluding the pathological condition, we can make physical therapy adjustment later. In addition to this, you should also pay attention to improving bone function, including the blood flow, doing more exercise appropriately, proper diet, and rest. And welcome to take another follow-up assessment with our equipment after a period of time. Thank you.